Namaskaram. Special good evening to everybody. First of all, I congratulate Professor Srinivas not only performing as the Dean of this ESIC Medical College, but has come out courageously as a successful frontline warrior after his treatment after 17 days, and he has now tested negative, but in spite of that he wanted every one of us to be very safe. So with physical distance I have wished him all success, and he is a role model because need not panic about the situation, and because of our situation, if we acquire the virus also, we can come out successfully, safely after the treatment. That only Dr. Srinivas is standing here as an example. So another thing, who are all having symptoms and who have contact history, kindly get tested, because doctors like him treated patients with COVID and they acquired the virus. So please, kind enough to the society and yourself, so that when you have symptoms and you have contact history, get the test done. And apart from that, I have to say, tracing, testing, now we have entered the era of treatment. So treatment varies according to the patient's condition, but need of the hour is the plasma therapy. You know, some of the medicines help in some conditions, plasma therapy helps in some conditions, and for sick patients, when it is warranted, plasma can definitely save a patient. So plasma can be donated. A patient who recovered can save a patient who is suffering. So it's a humanitarian donation. But there are a lot of misconceptions about the plasma donation. So my aim is very proactively, because ESIC Medical College is having all the requirements for a plasma bank and plasma donation. So I want to inspect all the facilities, and they are having all the facilities to separate the plasma, to test the donors. The donors, I should say, all of the people who have all got treated cannot be the donors. They should have the antibodies. They should not have the antigens. So IgG antibodies, adequate number they should have. When I inquired with the doctors here, they told they tested 60 people and 4 of them had adequate antibodies and they are the potential donors. So everyone cannot donate. Who all got treated, who had mild symptoms and who were asymptomatic, they cannot donate. But the patients who had severe symptoms and they develop antibodies, antibodies are the warriors fighting against the disease. So when we are fighting against the disease, our body produces antibodies. So when that antibodies through the plasma, it is given to the patients who are suffering, they will be rescued and saved. So very proactively, as a catalyst, not only as a governor, as a catalyst to save the patients of Telangana, to save the people of Telangana, I want to act as a catalyst so that between the ESIC and the people and the government, so that no patient in Telangana should die want of plasma, should lose their life for want of plasma. Everyone should be saved. Should not leave a single life. That is my aim. So another thing I should appreciate Mr. Santosh, his name is Santosh? No, that donor. Yes. Santosh. You stand. Come here. Stand. Santosh, he is a plasma donor. He suffered and he was rescued, recovered, and now is kind enough to donate the plasma. So I appreciated his service. So I congratulate Santosh for your kind heartedness, and really I appreciate you. On flower bouquet with it. From there itself you do. So I appreciate he is a role model and he has come to again to donate. So all the misconceptions, because I am very pained by receiving the request for plasma. Yesterday 1 o'clock, 2 o'clock, midnight, my inbox and my WhatsApp filled with requests for plasma. Such a painful situation. So I want to streamline the plasma donors. With the help of Srinivas, the Dean of ESIC, and all the hematologists, because this is the transfusion medicine. This is one of the hospital which have all the facilities for plasma donation, and here qualified people, qualified for transfusion medicine. So they can help the people of Telangana by organizing a plasma bank so that a portal can be created. Portal can be created and the case sheets can be uploaded and the need of the patient can be assessed and plasma can be arranged. It's not a simple procedure. It needs a very systematic procedure. So I request all of you to propagate positively the need of the plasma and to encourage the plasma donation. And I want to encourage and motivate the plasma donors like Santosh, because it is a service to the mankind. The people donating are not affected anyway. So I request the people of Telangana and the government of Telangana to support for organizing this, and I should thank our ICMR and the Central Health Ministry, because they have given permission after seeing all the facilities to the ESIC, and I should appreciate the staff and all the members, doctors, particularly Professor Srinivas, and I should say Professor Srinivas, in spite of his COVID condition, he didn't ideally sit in his room. He moved all his office inside room and he was working. So if anybody, unfortunately, if you acquire the disease also, no need to panic, isolate yourself, because it is service to yourself and service to others. And I appeal the people of Telangana, please maintain physical distance, always wear mask, wash your hands with soap and water, and if soap and water is not there, sanitizer, please be at home. Unnecessarily don't come out. If you come out also, please maintain the social distance and be safe. So I pray that very soon we will organize the plasma bank, and I appeal the people of Telangana and appeal the people who are the potential donors to come forward without fear to donate plasma. And as I said, all cannot donate. If you come forward, there are testing facilities to find out whether there is antibodies. Not only antibodies, adequate antibodies are there. So there are facilities to test that, and after testing, the plasma may be taken and donated. So I appreciate the efforts, and my aim, I came here not as the first citizen of Telangana. I came here as one among the common citizen of Telangana. My aim is only constructive. My aim is only complementary to the government. My aim is only to cooperate with the people of Telangana, complement the people of Telangana with good health and safe life. So my aim is to save each and everyone, the people of Telangana, from this critical situation of COVID-19. Thank you so much. Thank you. I thank all the press for your cooperation. You are also the first line warriors, and I thank all the first line warriors, the doctors, the paramedical, the policemen, the press people and the sanitary workers, all of them. I salute them for their exemplary work in this critical situation. Thank you so much. This is for the press with physical distance for your work, because you are also risking yourself and creating awareness to the people of Telangana. This is all the bouquet to you all. Thank you. Thank you, Doctor.
Thank you, ma'am.